Hello YouTube family. Today I'm going to talk about some long-term effect of COVID-19. What does it do to the body and what does it do to the eye? And again, as you already know, COVID is a terrible thing. As of March 2021, we have about 28 million Americans have been diagnosed with COVID-19. And of those 28 millions, about 10 to 30%, possibly about 8 million people is fall into the category of what we call long hauler. What is long hauler? And that is a term to describe those people after they are being infected with the COVID, and after 4 weeks of the acute symptom disappear, they still have what they call the long-term complication beyond the 4 weeks to 6 weeks of time. And colloquially, we call this long hauler. They are not fully recovered from COVID. They still have lingering symptoms, persistent symptoms after the COVID is test negative. So what are they? Basically, before we talk about the long hauler symptoms, you have to look at how COVID-19 attack our body. COVID-19 is the reason they call a spike is because they do have spike proteins on the surface of the COVID virus, and they attach to a body through a what we call a angiostensin converting enzyme 2, what they call a ACE2. And the ACE2 is a receptor. It's kind of like you look at that as a receptacle on the surface of certain organ, such as the lung tissue, the kidney surface, as well as the blood vessel, the vascular surface, as well as immune cells, your antibody cells, as well as your nerve. So all this surface of those organs have what they call the ACE2 receptor, and then the COVID-19, the protein, the spike protein attached to it and causing damages to certain organs like the GI, your gut, your nervous system, your blood vessel, as well as your kidney and also your lung tissue. And that's why you have all the symptoms of fever, stomach upset. That's why you also feel like difficulties in breathing, as well as dizziness and all those muscle discomfort is because of the attacking of the nerve tissue. Now, so because of all this ACE2 attachment, they will cause direct, of course, toxicity because of the virus, fever and all those symptoms. But again, they're also causing immune system. One of the bigger thing is immune system dysregulation is your body responds to it much worse than other viruses because again you lost control of your immune system. And also one of the things that we always worry about is what they call the hypercoagulability of the blood clot, meaning that your blood clot together, your platelet clot together super fast. So causing a lot of blood clots, causing a lot of congestion of your blood vessel. So it's dangerous, So again, all these symptoms go away after proper treatment or your body fights against the virus. But again, majority of them after, like what I say about 10% of them after this symptoms gone, this acute or sudden attack gone, they still having symptoms such as fatigue, such as muscle weakness, pains to the joint, and then respiratory. You have difficulties or difficult or labor in breathing, and also psychiatric symptoms such as a headache, such as sleep disturbance, such as anxiety, and then also you also have what you probably heard of people talk about POTS, P-O-T-S. That is when you're waking up from a supine, and when you get up from lying down and getting up, you have massive dizziness or nausea, and those are what we call the POTS symptoms. And also, one thing that we always have to look for or always have to watch out for is abnormal blood clot. After you have COVID-19, you also have risk of cerebrovascular accident, meaning stroke. And you also, for some reason, we also notice that people after they have COVID-19, they have a harder control of their diabetes condition, as well as increased episode of grave disease. So all those are messing up with our endocrine or immunological system. So besides drinking a lot of water, besides seeing the doctor to take care of the other symptoms, COVID also affect the eye in a certain way. How do they affect the eye? Is because they is part of an inflammatory condition. Dry eye and persistent red eye will occur for those long hauler. They become contact lens intolerable because of chronic inflammation. It's just that they have all kinds of inflammation and make it difficult for you to wear contact lenses. Sometimes they also complain about double vision or eye strain when they're reading because of certain neurological condition, because of cranial nerve dysfunction. They also notice that sometimes long hauler will have brain fog symptom because of what we call dysautonomia, meaning that the COVID-19 actually attack your autonomic nervous system, forcing it, making it difficult for you to concentrate, making it difficult for you to understand certain words you read. Also, we see people that have blood or hemorrhage to the retina, causing field of vision loss. And lastly, painful when they're moving their eye because of optic neuritis. Those are complications long hauler experience after they're suffering from COVID-19. And most of the situations that we mentioned about have treatment for it. We were able to, if you have brain fog or double vision, we sometimes can correct them by using prism glasses. Intolerance to contact lenses because of chronic inflammation, we can use eye drop medication to control that. Retinal hemorrhage, we need to have surgical intervention by a retinal specialist to stop the hemorrhage. Optic neuritis, again, sometimes we will need IV the steroid in order to prevent it from getting worse. So all these conditions need to check out to make sure that you have a good long-term prognosis, long-term result because of this COVID-19 symptoms. So any question, again, as usual, call us, text us, and come to visit us so we'll be able to help you to decipher what is the problem that you have. Thank you again.